In the last few weeks of the outbreak of cholera in Lagos, there's been several interventions by the Lagos state government. To update the public on recent developments, the state government, through the Commissioner for Health, Professor Akin Abayomi, held a press briefing. The press briefing had members of the state executive and relevant agencies providing latest updates on the outbreak of cholera. The commissioner started the press briefing by giving the total number of suspected cases so far in Lagos.
We have the data that represents the total number of suspected cholera cases, and that number is 579. Out of this 579, we have unfortunately experienced 29 deaths. Most of these deaths were caused by patients presenting very late at a stage where we could not resuscitate them because they had severe dehydration, and many patients were actually brought in dead. Out of all the samples we were able to collect, we were able to identify Vibrio cholera. So this is indeed a confirmed case of a cholera outbreak by a subtype 01 that is known to us to be very contagious.
The commissioner also spoke on distribution between the public and private hospital, stating that patients presented more to the public facility.
You can see that majority of the patients presented to our public facilities, either our secondary general hospitals or our primary healthcare facilities. So we had 209 suspected cases in our general hospitals and 193 in our primary healthcare facilities. We also had a significant number presenting to private sector hospitals with 152, our military and police and security facilities, and our tertiary hospitals, Lasuth and Luth.
The commissioner stated that the government is in complete control with an incident command structure.
One of the main principles of curbing the spread of a dangerous pathogen is to offer treatment absolutely free of charge of any suspected case in our government hospitals. That makes sure that we can attract patients to our facilities without them worrying that they have to pay. It allows us to remove from community patients who are infected. Thereby, we're able to slow down the transmission and bring an end to an outbreak.
Also speaking, Commissioner for Basic Secondary Education in Lagos State gave update on activities carried out in schools to prevent the spread of cholera.
We ensure that we have stable water supply to our students and pupils so that they can wash their hands adequately before they enter the classroom and probably after playing during break period. And we also have put in place a team that checks the food vendors in the schools to ensure that we have a very safe food and fruit that is being sold to our students and pupils. We also have a team that check regularly our toilet facilities, and we have also trained and enlightened our teachers on the necessary step to take.
Citizens were advised to help the government by adhering to preventive measures as well as presenting early when contracted. Esther Omelo, Rapid TV, Lagos.